In health news tonight, individualized therapy for patients dealing with depression.
It's a focus of a DNA study that's happening right here in Connecticut. News 8's medical reporter Jocelyn Mamita is live in our New Haven newsroom tonight with more on how the outcome could have a huge impact on how doctors treat people with mental disorders. Jocelyn.
And Darren, you've heard me talk a lot about targeted therapy, especially when it comes to cancer. Now, researchers at Hartford Healthcare are refining what they already know about DNA testing and applying it to patients with major depressive disorders.
It's estimated 1 in 10 people in the United States struggle with depression. Symptoms are varied, and so is treatment. But a specific enzyme could be key to unlocking what is most effective for the patient.
Different people have different versions of the enzyme.
Through DNA testing, noted personalized medicine specialist Dr. Gualberto Roaño focuses on CYP2D6.
It metabolizes or processes many of the medications that we use in mental health.
In a clinical trial, researchers at the Genetics Research Center and Institute of Living at Hartford Hospital are measuring its function, then applying it to patient care. In short, targeted therapy for mental health patients.
It's very similar in that it uses the individual's genetics to tailor the right treatment.
An earlier study conducted here showed deficient patients had longer hospital stays and more medication changes. Psychiatrist-in-chief Dr. Hank Schwartz.
If we know that somebody's genetically predisposed to have side effects with one antidepressant but not with another, we can avoid those side effects.
A crucial component to this study, an online guide for practicing physicians.
So all of them are appropriate for this patient. The patient has functional enzyme levels for cytochrome 2D6.
The range of medication to prescribe for patients taking part. For someone with no function, more red than green.
Those drugs cannot be prescribed in the study because the person doesn't have the capacity to process these medications.
We need to move this information forward so that genetic testing becomes a standardized step in the treatment choice for patients with mental disorders.
Dr. Schwartz tells me he expects the study will impact mental health and the overall healthcare system in a number of ways, including better outcomes for patients, shorter hospital stays, and lower readmissions. The 5-year randomized trial is only offered to patients admitted to Institute of Living, 18 to 65 years old. It is federally funded by a Department of Health and Human Services agency. Darren?